order. Calling it to order on Monday, June 13th, 2022 at 5:33 p.m. Can I ask all Board of Health members to announce themselves? Greg Thomas, Board President.
Morgan McMillan, Board Vice President.
Brooke Harrison, Board Member.
Lindy Hinman, Board Member.
Okay, well, we don't have Landry yet, but we do have a quorum.
Landry is unable to join us this morning because of a family conflict.
Okay, no problem. Then we have a quorum. And let's see, the regular meeting of the Boulder County Board of Health has been called to the order at discretion of Boulder County Public Health Executive Director Camille Rodriguez. Notice of this meeting was posted at the Board of Health's website as required by law and included the conference phone number and conference ID so that members of the public could participate in the meeting. We are still meeting virtually due to COVID-19 pandemic. And this meeting is being held via webinar as authorized by our Board of Health bylaws. So we will just kind of follow the procedure that we've had here for the last several months, where due to the volume of staff presentations, we'll have staff be introduced as they are presenting. And so I guess, do we have people logged in for public comment? Thomas or Jordan?
Yes, we do.
Okay.
So we'll have 9 individuals speak during the public comment section. I will bring each of them on individually as a panelist. They will have 3 minutes to speak. So the first one we have is Timothy Osborne. Let me see if he's available. Okay, I do not see him on the list, so I'll go down to the next one, which would be Scott. Do not see Scott either. Okay, the one that we have available is Dee Napper. So Dee, I'm going to bring you on as a panelist, and you'll have 3 minutes. Are you there, Dee?
Here we go.
Yes. Hi. All right. Your 3 minutes starts now.
Okay, great. Thank you. I'm confused though. Why are you still meeting virtually when we have no emergency? As a board, why can't we see you in person?
We are still meeting virtually because of logistics with setting up meeting space for hybrid meetings that will still allow public to attend virtually if they so choose. And that's the main answer.
Okay, well, I would love to see you get back to normal. I think this is a whole lot of work for nothing, but I am a nurse. I am a former school nurse. I am a public health nurse. I am a pediatric nurse practitioner. So I do speak with a little bit of experience here. And I do not understand how you can even consider giving millions of doses of COVID for 0 to 5-year-olds when it really hasn't even been authorized yet by the FDA. True, they're close, but they have not authorized it. There's no data on the Pfizer or the Moderna vaccines. It's most of the children, the 0 to 5-year-old that you're going to be talking about, they've already had it. They had it way back when, in February, and it's been shown that they've had it. So why would you want to waste all this time and money on vaccinating them again? I don't understand what the rush is to vaccinate the 0 to 5-year-olds anyway. They are not at risk of dying at all. They probably have already had it. It makes no sense for most children to have this vaccine, particularly when we're talking now about variants. Omicron, the vaccine was made originally for the Wuhan original virus. Well, we don't even deal with that anymore. And we know that so many people who have been vaccinated have ended up with the vaccine, or I'm sorry, have ended up with the actual disease, from parents
30
to
seconds.
teachers, everything. I would urge you to wait for a whole lot more information from the feds, from your Congress, who is also asking the same questions, before ever giving this unapproved vaccine. I think you will be open to lawsuits. There are too many terrible things that are happening. Heart problems, it's just not good. There's no long-term studies yet. Please wait before you ever mandate this disease. Why it's been
3
ordered
minutes.
early, I don't know. So I would thank you for listening to me, but this is not in the books at this point in time. I think most parents, very few will get it. Thank you. Any comments, questions?
And so there really is no back and forth with the public comment, just each individual has 3 minutes to speak.
All right, next we have Charlie Lynn. So Charlie, I'm going to bring you on as a panelist. So Charlie, you would have to accept to be a panelist. Okay. So we'll move on to, oh, there's Charlie. Okay, great. So you can unmute and you have 3 minutes.
Good now. I assume all of you are in the medical profession, and you must know that disease must be separated from infection. The H1N1, for instance, in 2008 was very infectious, but it had a very, very mild disease. The efficacy of the Pfizer and Moderna vaccines is to decrease the severe disease and death, and not decrease the infections. That was not in its original efficacy with the Wuhan virus. Children have a very, very low chance of severe disease from COVID. The Pfizer and Moderna gene therapies are experimental. The long-term effects of these are still unknown. Now, I'd hope you'd recognize this, that there's very little benefit and some unknown risk in the future. The standard of care is informed consent. I hope you will ask the parents and explain to them the risk benefit and have them sign off on an experimental drug, the long-term effects of which we do not know, and has very, very little benefit to these young people. Do not experiment on children. Do it on us older folks, not on our children. Thank you.
Okay. Next, we have Cynthia Nevison. Cynthia, you can unmute and your 3 minutes will start when you're ready.
Okay, hello, yes. At its May meeting, the Board of Health discussed some questionable policies, including planning for the COVID vaccine rollout for 0 to 4-year-olds, back to school booster shots for older children, and focus groups to combat COVID vaccine hesitancy with a goal of persuading parents of young children, especially Latinos, to accept COVID vaccines. This last policy uses taxpayer dollars to target parents to try to override their natural best judgment. The presumption is that government knows best, when in fact parents who are reluctant to give these products to their children may have very good reasons, such as 1, COVID poses very little risk to children. 2, their children may already have natural immunity to COVID. The CDC's own data show the large majority of US children have already developed some form of natural immunity. 3, the COVID vaccines are ineffective for children. Pfizer clinical trial data failed to meet even the low standard of 50% effectiveness for 0 to 4-year-olds after 2 doses, and now they're applying for a 3-dose EUA. Moderna's trial data showed only 37% efficacy for children 2 to 5. These statistics do not inspire confidence. Even worse, CDC researchers recently found that mRNA vaccines actually had negative efficacy for 12 to 15-year-olds less than 5 months after the primary series, meaning they were more likely to get infected than the unvaccinated. The CDC's answer is to give them a booster. But isn't it better for children to rely on their natural immune system rather than being set on a path where they will need potentially dozens of booster shots over the course of their lifetimes, each with a non-negligible risk of serious side effects? And that's reason 4 why parents are wary of COVID vaccines. Children and teenagers have suffered vaccine injuries ranging from myocarditis to neurological issues to menstrual irregularities. Many pediatricians who are observing these injuries in their practice are intimidated, but starting to speak up. For example, Dr. Kirk Milhoen, quote, "For many kids, it's all risk and no benefit. What are we doing?" Dr. Michelle Perro, quote, "Clearly these vaccines are dangerous for kids. The data is irrefutable, and yet we've proceeded." Dr. Rennie Moon, quote, "The lack of regard for safety is highly unethical. I personally put it into the arena of crimes against humanity," unquote. Last Wednesday, 18 members of Congress even got involved in this issue. They wrote a letter to the FDA asking them to justify why they are pushing ahead with mRNA shots for kids in the face of their significant adverse effects combined with low or even negative efficacy. The same question could be asked of you or local health officials. What are your reasons for promoting COVID vaccines for kids, and on what scientific and ethical considerations are these policies based? Thank you for your attention.
Next, we have Carolyn Biznitsky. Carolyn, you can unmute and your 3 minutes will start when you are ready.
Hello, my name's Carolyn Beninsky. I live in Boulder, and I agree with the prior 3 speakers on those issues. And I want to say I'm very concerned with the county's plan to hold groups to convince parents to give their children the COVID vaccine. The euphemism is combating vaccine hesitancy. If this is the intent of these groups, then the county will be in violation of federal and international law. Even if the state provides the funding for this program, you will still be in violation. Following orders does not exonerate you. Why do I say this? All currently available COVID-19 vaccines have been authorized by the FDA under emergency use and cannot be mandated. Also, coercion of any kind is prohibited. The vaccines are experimental medicines. None of the vaccines have been licensed by the FDA. The right of Americans to decline a vaccine, medical procedure, or medicine approved under emergency use is protected under U.S. law. Coercion of any kind violates federal and international law. Informed consent is required. People must be given all, and I want to emphasize all, the information about the significant known and potential benefits and risk, and of the extent to which such benefits and risks are unknown. I have provided the evidence of these statements in my written testimony. To emphasize once again, people must be told all the risks and benefits of an experimental medicine, and they have a legal right to decline any experimental vaccine. Coercion of any kind is prohibited. If you are holding groups to combat, quote, vaccine hesitancy, you are violating the law. These focus groups also violate the judgment by the Nuremberg crime tribunals, which laid down principles regarding medical experiments on human beings. The Nuremberg Code enunciates the principle of voluntary informed consent of the human being and prohibits fraud, deceit, duress, overreaching, or other ulterior forms of constraint or coercion. The code requires a provision of sufficient knowledge of the subject to enable a
30
person
seconds.
to make an enlightened decision. COVID vaccines and tests are experimental. All mandates of these products involve coercion. So do one-sided persuasion in which parents are not informed of the numerous adverse side effects and deaths following these shots. If you coerce parents in any way, including through persuasion or one-sided presentations or mandates of these injections or tests, you can be held accountable in federal and international courts.
3 minutes.
Thank you very much.
Lastly, we have Marty Hopper. So Marty, whenever you're ready, just unmute and your 3 minutes will start.
Okay, can you hear me now?
Yes, we can.
Okay, great, thank you. Hi, I'm Marty Hopper. I live in Boulder County. I'm also speaking tonight with concerns about Boulder County's COVID vaccine policies, which include the current mandate for county employees, as well as plans to continue promoting the injections for children and possibly even infants. First, both data and logic tell us the vaccines are not working. According to the Boulder County Public Health Department website, 82% of Boulder County residents ages 5 and over are fully vaccinated, making it one of the highest in the country. If the COVID vaccines work, what is the reason that the CDC now lists Boulder County's community level for COVID-19 as high? Also, according to CDPHE, the majority of Coloradans hospitalized for COVID right now are vaccinated, meaning that the vaccines are not preventing serious illness or hospitalization. Regarding children, I also have grave concerns about the safety of these vaccines. Although vaccines are given in abundance for childhood illnesses, we all know that COVID-19 is not a childhood illness, but one that mostly impacts older adults. National data demonstrate that the likelihood of a child surviving COVID is over 99.99%. You may be thinking that COVID vaccines are perfectly safe, but remember that all of these vaccines for children are approved by the FDA on an emergency use basis only. So we must ask, are the children of Boulder County truly facing a health emergency? The number of deaths in Boulder County from COVID-19, according to your website, is 372, which is 0.1% of our residents. I tried to find the number of those deaths who were children, but this information is not available on the Boulder County website. When I contacted the health department, I was told you don't collect COVID fatality numbers by age, and that I should check the CDC national data. It seems imperative to track such data before promoting an experimental injection for our children. According to VAERS, the CDC's vaccine safety monitoring
30
system,
seconds.
there have been over 49,000 children ages 5 to 17 who had been injured by a COVID-19 injection. And finally, as you know, and have heard tonight, there are no long-term safety data for these vaccines. Are you personally comfortable promoting an experimental pharmaceutical injection for babies and children for which the long-term consequences are unknown? I ask for your sincere consideration of these concerns. Thank you.
That concludes our public comments.
Okay, thank you, Jordan. Can I ask a clarifying question, Camille or Indira? I'm not sure where this May meeting stuff, I mean, other than talking about planning for the eventual approval of vaccines for children under 5, there was no talk of any mandate for that, correct?
Greg, I'd be happy to have Indira answer that specifically. The recollection of mine is the same, and there was no intention by Boulder County Public Health to mandate any vaccines for children, if that's what you're asking. But Indira, are you able to hop on and
Yep, I'm here.
and answer a little further into that for us? Thank you.
I can't remember exactly what we shared in the May meeting, but I do think we shared that we were in preparation for the FDA's approval and the approval by the ACIP to for CDC to provide that guidance for what vaccines will look like and how it will roll out for under 5s. So we do prepare for that because we do offer those vaccinations, but there is no mandate associated with that. It's just being able to offer those vaccinations to the general public. And we do have focus groups that we have ongoing, but none of those focus groups are mandating anything for vaccines. In fact, we're just asking parents what their thoughts and concerns are so we can better learn and appreciate all sides of how people feel about vaccines in Boulder County.
Okay.
Thanks, Indira. Yeah. Is that good, Greg? Do you need more?
Yeah, that's fine.
Thank you.
It just seems like parents have their own choice to make, and that's where things stand currently.
Yes.
Okay. All right. Well, we are going to move on to item 2 of the agenda, which is approval of the minutes. And we had the May 9th regular meeting minutes. We had May 23rd special meeting minutes and June 7th special meeting minutes.
This is Morgan. I'll make one motion for all 3. So I move to approve the minutes for the May 9th regular meeting minutes, the May 23rd special meeting minutes, and the June 7th special meeting minutes.
Brooke, I second.
All in favor? Aye.
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 Okay, motion carries. Item 3, Marshall and Middlefork Fire Situational Awareness and BCPH response.
Yeah, thanks, Greg. As you indicated at the beginning of the meeting, we were not going to list every staff person that's present, but wait until the presentation. At this time, we have Joe Malinowski, our Environmental Health Division Manager, to give an update. So I'll turn it over to Joe.
Thank you, Camille. Good evening, board. For the update today, what I thought I would do is take you through each of those areas that we've been talking about for our environmental health response and really focus you on what were the original goals and objectives in each of those areas, whether it's the food safety or the air quality or healthy homes or the hazardous waste or water quality, but just those original goals and objectives that we had set, and take a look at those, and also take a look at the kind of the time frame of when we expect to, if we haven't already moved away from some of that work, when we expect to be able to move away from that work, or at least be able to be not in such an emergency mode and be able to move it into the individual programs to still respond. So first slide, please. So just looking at food safety, our original goal is to ensure retail food establishments impacted by the fire, mitigate those food safety risks prior to reopening. And then again, the other part of the sector was the residents that were impacted, and so they were aware of what to do with the spoiled food in their homes and those kind of things around food safety. And really, the team did a great job here. I think we reached out to we did actual inspections over 100 restaurants. We reached out to all the restaurants and the retail food facilities in Superior and Louisville. I think there was, out of those 100 facilities, there was 25 that were really impacted that really had direct impact from the fire. And I think all of those, there's, I think 3 that probably will not open just because they were severely damaged and perhaps just chose not to open. Then there's a couple others that are just rebuilding. So out of that 100, there's about 5 facilities that are still working to reopen to get back to business. And again, most of this work was really wrapped up at the end of February, first part of March. And we will continue to work with those individual restaurants and retail food facilities. Most of that work is just going back to our regular programmatic work. Next slide, please. So hazardous waste, we really focused on this was really ensure the fire and ash impacted soils were remediated to mitigate health and environmental impacts. And really, what we really did was work with CDPHE to figure out what was the best way to approach make sure that there wasn't going to be hazardous waste remaining after the fire. Originally, the state just wanted to do visual inspections of just requiring to make sure there's asbestos, no testing. We wanted to, based on some California data we saw, we felt that there needed to be some testing done. So we did our own testing of soil sampling. I'm also aware that some of the schools and the municipalities did also some additional soil testing. And we ended up using that data for not only to look at the risk to the public, but also to help coordinate the resource conservation approach to their the soil sampling parameters for the cleanup efforts. And then we also developed just multiple frequently asked questions resources on the web to help residents with that. So really that work is pretty much, we understood the level of contamination. We were able to set that protocol, and most of that work was wrapped up in April. Although we do consider to do look at some of the results that they're getting from the actual cleanup and the testing, make sure they're still following the guidance. Next slide, please. So water quality, one aspect of that was we were looking at the unincorporated areas. With most of those folks were on wells. So the water quality team really wanted to support homeowners that were on private wells to be able to understand if their water was safe or not from the fire. Not a lot of research in that area, so we were concerned just with what was the effects. Perhaps there was back siphonage from the homes and those kind of things, or actual direct damage to the well heads that we wanted to make sure we could evaluate. So what we did was just worked with our communication folks to develop guidance around what to test for. We provided a list of laboratories. We collaborated with CDPHE and their toxicologists to be able to answer questions on people for those results. And then we also worked with Purdue University on some actual testing they did for VOCs. And what we really found out, there wasn't much impact from VOCs, at least from the fire, but there were components of the water system, wells and electrical, that were damaged, that we were able to just help people navigate to get those fixed and know what they needed to do to repair. And again, most of that work was wrapped up in May of this year. Our next one is septic systems. I'm sorry, this work is probably where we'll be spending most of our time in the future. So there was 150 homes that were damaged, over 150 homes that were damaged in the county that are on septic systems. And our goal is to enforce the regulatory requirements around that. So what we did, we worked with the permitting and group at the county to develop the process for people that were damaged in the fire to be able to go through a process to get permitted more quickly. We coordinated resource conservation to make sure that during debris cleanup, people weren't driving over septic systems, so they knew where those systems were. And we also did a reconnaissance of what the damage to a septic system looked like for post-fire. And what we really observed was a lot of the tanks that had plastic lids in that were melted. And we provided guidance on what people to do to get their homes back, at least their septic system back to working order. We expect this work because there's 150 homes and people will take a long time to navigate the process to get rebuilding and everything that is involved to do that. We expect to be working in this probably for the next 5 years to help those folks, 150 systems, get re-permitted and reestablished. Again, this is probably where we'll spend most of our time in the future. Next slide, please. Another aspect of water quality was the stormwater work we did. And really what we're trying to do is protect surface water quality from impacts from the burn scar, really runoff from the fire. And really what we did was just, we serve as the regulatory authority for stormwater in unincorporated parts of Boulder County. And we need to maintain compliance with the Clean Water Act. And then we also we facilitated regulatory compliance around the technical support for debris removal. So we just wanted to make sure when they were removing debris, they weren't causing additional debris that could be washed into the storm drains. And really what we ended up doing, really consulting with them. If you remember, there was the hydro mulching we talked about that stabilized the soil to keep a lot of that from running off. And that was really highly effective. We also collaborated with partners in Superior, Louisville on their stormwater issues as well. And again, we expect this work to really coincide when we expect the actual cleanup to be completed, which we expect to complete around the end of September of this year. Next slide, please. Next slide.
I just changed it to outdoor.
Thank you.
Yep.
I wouldn't see it. Okay. For outdoor air, really what we're trying to do is monitor, report air quality to impacted residents in the burn area and provide guidance on the mitigate health impacts. And we also want to ensure that air quality impacts are minimized during debris removal. And really, we presented multiple times to the board this, where we were able to work with the municipalities and the schools and set up those 26 air monitors looking at particulates. We contracted with Clarity for those monitors. We also worked with Love My Air and Denver Public Health to get those the actual data on web. Worked with our communication folks, worked extensively to try to make that as user-friendly as possible. We also developed those user alerts so people can sign up to have actual communications pushed out based on that air quality that we had showed you before. We use this also to help establish the air monitoring requirements during debris removal. So the contracts are required to have air monitoring in place so that as they're moving the debris out, if they actually have windstorms and those kind of things, they're doing what they need to minimize the dust, wetting it down and those kind of things, and not working when it's high wind days. But these monitors will help us know if they're actually doing a good job with that. And then finally, what we're trying to do is also ensure that some of the research is going on. We had NOAA that went through and did those drive-throughs looking for VOCs. Early on, we saw that it wasn't much higher than background, but hopefully some of that research can be used to help establish some of the perhaps residential standards, not looking at worker standards for exposure to those kind of contaminants, and then also how climate change perhaps affected Marshall Fire and some of the health implications and what we expect to see in the future. So just some of that research. And again, we expect this work to be wrapped up approximately the same time that the debris cleanup winds up around September of this year. Next slide, please. Another really robust area of our response was around the indoor air and healthy homes. We just wanted to ensure that homeowners had the information they needed to properly clean up their homes and mitigate the risk, and also know if they were impacted, what to look for. We also wanted to ensure that guidance was developed around windblown ash for the public spaces. So we developed multiple information on the web around that guidance. We worked with the school districts who did testing on their indoor air quality. We provided help them provide just our cleanup guidance for their schools. We continue to partner again with those researchers that we're going into homes and doing air monitoring there as well, just to see what the VOCs levels were. And we also hired, if you recall, we also hired industrial hygienists that work individually with homeowners to answer questions and help navigate any reports they had. And I think that was very beneficial. We heard a lot of praise and just a lot of thank yous for that assistance he provided. And then longer term, we really like to make sure that the residents understand there's air purification systems they can use that can help in future when air quality impacts such as a fire occur. But again, this work, we pretty much are going to see it go away. Just the inquiries from the public have slowed down. So we expect that work to end by July of this year. Next slide, please. So again, not an exhaustive list of all the work we did in each of those areas, but hopefully you saw that most of that work we hope to come to an end by the time the debris cleanup's done, except for the septic systems. We expect to continue that work for the next 5 years. Happy to answer questions, Morgan.
Thanks, Joe, to you and your team for really just doing so much lifting around this recovery work, and so really appreciate that, and the contributions of BCPH through the community recovery. And I just wanted to sort of clarify on that expectation that permitting is going to take up to 5 years. That is, it's not that the septic system is the bottleneck of that whole process. I mean, there is the site cleanup, and then there's the design process and working sort of through, getting an architect and getting all of the permitting through, right? So just to clarify the expectation that this might take 5 years, there are many other hurdles, unfortunately, facing those who are looking to rebuild, not their septic system. Is that?
I think you're right. A lot of folks may want to change the design of their home, so they may be working with design, and then they have to find a contractor and just navigate. I know at the Pine Cliff fire, I think it's been almost 3 years now, and I think only a few of those homes have actually started to rebuild. It just takes that long to navigate the insurance as well.
Okay.
Yeah, I think you pretty much answered my question. It was that, so when do you expect the first homes to be able to initiate rebuild?
So as I understand, there's already folks working with the planning and the county's permitting and code enforcement folks to do the building permits. And they actually have developed a separate process for homes that were in the fire to just expedite them. From my understanding, I think we had one of our first contractors to trying to already start to go through to get a permit for the system. And if you recall, we did waive the fees for the septic systems of people that already had an approved system that they're just going to reconnect to an existing system.
Okay, thank you.
No other questions? Okay, thank you for the update, Joe. Appreciate
You're welcome. Thank you for
everybody's efforts. All right, item 4. We are at heat emergency project update.
Thanks, Greg. Oh, I was gonna introduce our climate action team, lead Grace Hood, as well as our air quality and healthy homes coordinator, Bill Hayes, to give the Board of Health an update on our heat emergency project. Go ahead, team. Thanks.
Thank you, Camille, and good evening, board. Bill Hayes, air quality coordinator, here to present tonight our extreme heat emergency response plan. So this work began last year after the Pacific Northwest had their unprecedented heat dome. We realized that this was an area that we could improve our emergency response. Initially, Rachel Arndt, Chris Campbell, and Carrie Middleton in emergency preparedness, the 4 of us met several times, talked about how we might put such a plan together, but it really didn't gain traction and start moving until October when we brought Grace Hood on. And so I'd like to acknowledge her great work in leading this effort. We've also partnered outside of public health, working with the Area Agency on Aging, working with Via Mobility, working with our public library systems, working with our Emergency Operations Management Center. So a lot of people have put some input into this plan. Grace is going to tell you about it, and the only thing else I'll add is, this is going to be test run this summer. We're fully expecting to learn as we go and make the plan more robust in the future. This is our first step for this summer. So I will turn it over to Grace.
Thanks so much, Bill. And I just wanted to mention, for those of you who missed it, that Grand Junction had an extreme heat warning over the weekend. And unfortunately, there was one person who died related to heat-related illness. That was in Palisade. So it just kind of highlights the importance of this plan and our work that's going to be happening over the summer. Head to the next slide. So risks of extreme heat. You see here on this slide that actually extreme heat causes more deaths than any other weather-related hazard. That's more than tornadoes, extreme cold, even wind and floods. Sometimes people refer to extreme heat as the silent killer. And this doesn't even count the thousands of people who get medical treatment for heat-related illness. Next slide. So Bill had mentioned the Portland heat dome. So some interesting statistics. So in Multnomah County, this is just surrounding Portland. Obviously the heat dome also covered Seattle, but I thought I would draw to your attention to the fact that half of the 72 deaths in the county surrounding Portland were older adults. And among those who died, none had air conditioning. Kind of speaks to kind of a key demographic for us, which is older adults, but also the importance of air conditioning in terms of surviving an extreme heat event. Head to the next one. We also know that climate change is happening. It's here, it's arrived in Boulder County. We're estimating about an 8-degree Fahrenheit increase in summer temperatures in the coming decades, which would essentially make our climate feel like northern New Mexico. And boy, sometimes it just feels really hot already. This past weekend certainly felt that way. Head to the next slide. So who's at risk? Well, there's kind of two National Weather Service products that we're keying off of. The first is a National Weather Service warning, and this is the most extreme product that the National Service puts out on extreme heat. So this is where temperatures exceed 105 degrees or greater, and this is for 2 or more days. And this is also where nighttime temperatures may or may not go below 75 degrees at night. Under this more extreme warning, everyone's at risk. National Weather Service advisory, so this is where temperatures are above 100 degrees Fahrenheit for 2 or more days. And temperatures may or may not go below 75 degrees at night. And we have specific groups that are at risk. So older adults, outdoor workers, households without air conditioning. We have children under the age of 4, individuals with chronic medical conditions, as well as outdoor athletes. And in addition to these groups, Boulder County Public Health has also identified individuals living in manufactured homes and our unhoused population as high-risk groups. So let's head to the next slide. So for this summer, Boulder County Public Health, our extreme heat response, what we're working with here is during an extreme heat event, so again, that's a warning or advisory, we are asking individuals to go to a Boulder County heat relief site. So if individuals do not have air conditioning, we're advising them to go to the heat relief site, which is our local libraries. Head to the next slide. And a couple of points of note. So fans during a extreme heat event really are not effective at preventing heat illness. They can't cool the core body temperatures. So that's why one of our key messages is that air conditioning is the #1 way to stay safe. And it doesn't even necessarily have to be going to a heat relief site. We also have talking points in our press release and information about, hey, indoor malls, go to a movie. There's a number of different places where folks can get relief. We also have advice about checking on your neighbors. It certainly seems like after the Marshall Fire, we've been through a number of emergencies here in the last couple of years. So our advice to folks is really to establish those relationships with neighbors early before an emergency, but certainly during an emergency. If you have an older adult, particularly an older adult who's living alone, check in with them, see how they're doing, and maybe invite them over to have a cup of coffee if you have air conditioning and you notice that they don't. Head to the next slide. So what are we doing for outreach? Well, right now, in the coming days, we'll be doing an early summer information push. So that'll be a press release in English and Spanish, just sharing some of our talking points, but also pointing individuals towards our webpage that has a number of information. It has a lot of information and also infographics in both English and Spanish on just what does heat-related illness look like. We also last month held a webinar for both older adults and for outdoor businesses related to extreme heat. So I mentioned we've been doing some outdoor business outreach. And then in terms of the other component of our older adult education, the other thing that we're doing is distributing a 2-page flyer that we've developed that really talks about heat-related illness and how to stay safe during an extreme heat event. We're going to be using and working with our partners, Area Agency on Aging, and really working with partners like Meals on Wheels to distribute these flyers in both English and Spanish. Manufactured home communities. We are going to be holding a webinar later this summer to work with individuals who live in manufactured homes. Homeless Solutions for Boulder County Outreach Collaborative. So they are really a key partner for us during a heat emergency. And these folks are really our prime sort of channel for getting information out to our unhoused individuals about where they can seek refuge and air conditioning during a heat emergency. We've also have a number of efforts to Spanish language speakers. We're coordinating with Marina Lagrove. She's a new equity outreach specialist within our Oscar Sustainability Department. She has a couple of different ways that she's working with Spanish language speakers. One of them is just by doing a couple of media interviews that she plans to do here in the coming weeks. But she also hosts a hiking club for Spanish language speakers. That's another way that she'll be working with folks, but also we're going to be planning a couple of events here in about the next month. Head to the next slide. And you may also be wondering, well, what's next? So this is our first summer with this emergency plan. We're going to be circling the wagons in the fall just to figure out what worked and what didn't, what maybe needs some retooling. The other thing that we're working on is we're mapping heat islands and heat hotspots across the county. This is a project that we're working on with Resilient Analytics. They're doing a number of different mapping projects for the Oscar Sustainability Group. And our hope is that these heat islands will not only help us in an emergency, but also help us in terms of developing some adaptation strategies, getting air conditioning or heat pumps, which if you're not familiar with heat pumps, they also provide cooling. So it's a little bit of a confusing term, but I think long-term, we really need to be thinking more about adaptation and to what extent can we get either heat pumps, which are a little bit more climate friendly, or air conditioning into the homes that really need it. And head to the next slide. I think that is it. Thank you so much. And I welcome any questions that you have.
Hey, Grace, this is Lindy. Thank you so much for that report. I was just about to ask you about getting cooling units into people's homes. Obviously, I'm concerned particularly about the older population potentially not being able to leave their homes to actually get access to cooler environments. So I like to hear that you're partnering with the areas on aging. And I know there are some programs that already exist that potentially could help people with those resources. So if that's something we might even be able to focus on sooner in terms of specific populations where that might be applicable and even some funding to support that, I would be very supportive. So anything I can do to help with that particular population, I'd be excited to engage more around that.
That would be fantastic. I'll tell you kind of, we don't have a lot of granularity around that plan. I mean, really, we're relying on our partners at Area Agency on Aging, and Chris Campbell, who I'm sure you all know, is working with Via Mobility. But it's very much sort of more, I think, of a, the onus is really on the individual to say, hey, I need transportation to this place. I would love to hear kind of any additional ideas you have about maybe how we could be a little bit more proactive in that space.
Yeah, I'd love to offline with you and just understand more about what the potential near-term opportunities are, and then maybe what we can build out programmatically.
Great, sounds good.
And I'd jump in and add that when we've spoken with the Area Agency on Aging, they have a very robust call list for seniors in the county, and we have raised the possibility, it's not in the plan yet, that they could actively contact seniors that they know of that live alone that might need help. As far as adding cooling, as I said, this is our first year, but long term, we are already talking with colleagues. There's a lot of effort afoot right now to promote heat pumps as energy efficiency, greenhouse gas reducing options. And so we're talking with our partners that are looking at that on how we can focus that on lower income folks to help them. And then we have traditionally had weatherization programs that focus on insulating and heating homes for people through the winter. And I think we need to look at those existing programs and not shift the focus, but add to the focus cooling in the summer. So, some of those existing programs so that we're not starting new.
Morgan.
Yeah, thanks, Grace and Bill and others who have worked on this really important work. My first thought is, oh my goodness, we need to do more to lobby the state on climate work too. Just to do what we can to prevent all of this extreme weather. And, it isn't a foregone conclusion. There is much that we can do as a state and as a country and as a globe to try to mitigate some of the climate impacts. But thank you for paying close attention to this need. I also was thinking about early childhood centers, and I don't know if you are working or early childhood providers, not just centers, but there's a lot of in-home providers. And when you think about at-risk populations including young children, and just making sure, I know we have good partnerships with ECE providers through the COVID work, but ensuring that they are tuned into this also. I mean, a lot of early childhood providers do not have air conditioning, or they have unstable air conditioning. So thinking about how we can get messaging out to them to also just be familiar with what resources might be available to them. So just thinking about that. And then in terms of the unhoused population, I know that we have challenges with providing shelter during, not during the winter months in this community. And so, I'm curious, what other areas are we recommending other than the library that unhoused populations go to in the cases of extreme heat?
Yeah, Chris Campbell has been doing most of the outreach on finding places and kind of securing spots for cooling centers. We're calling them heat relief sites, but really it is the libraries that we're working with at this point. And, I will have to say, one of the interesting sort of conversations that we've been having is just simply the fact that I think there was definitely some concern among library staff, just like, hey, what kind of turnout are you expecting? And, our sort of initial response, and we did quite a bit of research, and was an amazing practicum student who worked with me last semester, Stephanie Pease. The sad truth is that folks right now really just do not use cooling centers or heat relief sites. And so kind of our initial response to the library staff is we're just really not expecting large numbers, but over time, I hope that as we just continue to educate the public, that we will have a larger demand for this type of service. But I think coming right out of the gate, there's just, we're sadly not expecting a huge turnout should we have a heat emergency.
Yeah, and I wonder what sort of opportunities might exist in working with faith communities who, you know, I think again, there's a history in this community of faith communities opening up shelter space for cold weather events to unhoused individuals. But, you know, could a similar partnership be worked into around heat events too? And given sort of the generosity of faith communities in that space, could we work with them to look at these events as well?
Yeah, that's a really great question. That's worth exploring. Good idea.
Yeah, I have just sort of a basic question. Is the website live?
It is. I'll drop a link in the chat.
So I'm just, I was just looking to see if I could find it, because I know a lot of the complaints that I get from the public is that they can't find information on the public health website. And so maybe consider dropping a heading link on the homepage, since this is something that's pretty important and we're already really dealing with it now.
Great idea.
Thank you. It's great work. We want people to find it.
Sorry, muted. It's a pretty, I just wanted to note, it's a pretty high bar for the National Weather Service to issue heat advisory, certainly, or a heat warning in Denver Metro, mainly because our humidity is so low. And so places like, you know, Texas or maybe even Pacific Northwest, although during their heat domes, they're probably getting a lot of dry air. So it won't be triggered a lot if you go off their criteria. I would guess maybe once or twice a summer, you'll have consecutive days that are above 100, but usually the lows always get below 75. So even then your low temperature criteria might not be exceeded, which I guess in the end is not a bad thing, right? Because it just means that in theory, that should be tolerable for more people, even though 99 and 70 degrees still makes it tough if you don't have air conditioning in your house and your house retains a lot of heat. So, you know, I think libraries are a good starting point. Frankly, they're open during the day. I guess my question would be is that in the future, if things like rolling energy outages as a result of demand and supply become a factor, which I haven't heard Excel talk about that at all. I have read about other places that are expecting, you know, potential rolling outages over the course of the summer based on supply and demand. But then, you know, what would happen in the event of, let's say we do get multiple events in a year, and daytime relief is one thing, nighttime relief is entirely different, right? Where you're talking about then maybe an emergency cooling center that has to have after hours operation and not just a facility like a library or a rec center that may have more traditional types of hours. So, but it's important work and we have to start somewhere. So good job, Grace and Bill.
Yeah, you know, and one thing, Greg, I'll just point out is you're absolutely right. I think we've only had something like 8 or 9 heat advisories or warnings in the state. But one thing we learned in the course of our research is that the National Weather Service is developing a new product called Heat Risk. And as a result of that, that's actually triggering more heat advisories for our Denver metro area. So I think we will start to see kind of more of these, and in the sense that the National Weather Service isn't factoring in humidity as much for our region, obviously, because we would never have a heat advisory or warning. But they absolutely use it in the Southeast and places like that. So sadly, I think we will be seeing more potentially to come. But it's a good point on the blackouts and redundancy. I mean, that's certainly something to just be thinking about in terms of having air conditioning backup wherever we do offer cooling.
And I would just add on that Grace and I had a really good conversation today with our colleagues up at the city of Fort Collins. We've been talking with them over the last year as they also develop an extreme heat response plan. And they're taking a kind of different tact on when they activate their plan based on forecast models. And so, you know, we had a great conversation today that said, this is actually good. We can test a couple of different approaches and see which one works best. And then ideally get communities up and down the Front Range all on kind of a similar system.
And Grace, this is Lindy. One more comment for me. And I don't know if this is just my perception as a resident or this is happening, but since the December fire, I feel like there has been an uptick in red flag warning signals coming out from Twitter and other places. So I wonder if we can sort of correlate that uptick in communication with the public in some way to ensure that we're getting the message out, even if we're not in a true heat advisory, that, you know, it's getting warm and to take precautions and all the things that we want people to make sure they're doing, particularly if they're in high risk groups, similar to air quality, similar to red flag warning days. Obviously, these things tend to be intercorrelated as well. So there might be ways we can camp onto some of these advisories and warnings more broadly.
And Sean Hollister's on the call, and I'm sure he heard that, Lindy, so thank you.
Absolutely. I'm not an expert, but I experience it through my Twitter feed.
Okay, well, thank you again. Glad you guys are thinking about that. If you're interested, Bill, we recently developed our cooling center guidance. However, that would likely pertain to what I mentioned in terms of an emergency shelter, right? Where it would be open beyond business hours, normal business hours. So it's pretty short. I'm happy to send it to you just for future reference.
Yeah, please do. Thank you.
Okay. All right. We will move on to item 4, which is, item 5, sorry, COVID-19 update.
Thanks, Greg. Yeah, item 5, our COVID-19 update. And tonight we have Communicable Disease and Emergency Management Division Manager, Indira Gujral, here to give us an update. Indira.
Thank you. Good evening, everyone. Good evening, board. I'm just going to do a brief COVID-19 update as we agreed upon last time, not to dive too much into the weeds. So next slide, please. So just some key messages up front is that we are still in a pandemic state, and the COVID response teams have been working over the past few months on internal plans to shift our response. And most of that has to do with reflecting changes in grant scopes of work. So we're getting different guidance from the federal and state governments who are telling us that they'd want us to move in a little slightly different direction in terms of case investigation and contact tracing. So I'm going to share a little brief overview with you today. And it's our hope that at the July Board of Health meeting that we'll be able to share more of a kind of a deeper look at the internal plan. Sound good? Because I know we talked about having something this meeting, but I think it's going to be closer to July. So we are still in high levels of state community immunity through vaccination and infection. I think back in April, we were closer to 90%. I think it's dropped. It's in the mid 70s now. We'll get the new community immunity, the rates from the School of Public Health. Their forecast should probably come out in the next week or so. But we're doing fairly well as a state. And as a community, our vaccination rates are pretty high, so we're holding pretty strong. We know that our variants will continue to emerge as long as we have community transmission, and that continues to be widespread. So right now, the predominant variant is the Omicron variant, and we're starting to see shifts to BA4 and 5 as they start to increase in prevalence, but Omicron is taking hold both in the state and in Boulder County. And in order for us to think kind of in the future and how we're going to support the community, it's really going to be a focus on vaccines and therapeutics. And this means that the virus is going to be present, but we are definitely going to be in a better position to manage the disease, both for our healthcare systems and for public health. And then we do know that we're going to experience some challenges with therapeutics access. So we are expecting that access to therapeutics is going to start getting harder as the federal funding cliff will occur June 30th. So what that means is that right now the therapeutics are free and they're being managed. The distribution across different sites across the state is being managed by the state health department. But it's my understanding that that federal money is poised to run out at the end of the month. And so this may cause us to have to pivot a little bit on the therapeutic side, which is another reason why we want to hold off on sharing our plans until potentially July so we can see what happens in the space.
Hey, Indira, I'm
Yeah.
sorry to jump in. Can I just ask you a question on that point? Is there, I have not followed, is there talk about what insurance coverage is going to pick up when the feds are no longer covering
I'm sure
therapeutics?
that insurance will cover it. The problem will be accessibility. So
Absolutely, sure. Yeah.
what happens if you're underinsured?
Yep.
You can't. And one of the challenges, and we can talk about this towards the end, is that you really have to go see a provider. So you have to have that connection to a provider and within 5 days of being symptomatic. And that makes it really challenging, particularly if you can't see your doctor within 5 days. So we have been working on this. We have a new website going up. We're working closely with the state. We actually have staff that are just focusing on therapeutics because we know it's the path forward, but it's not going to work for people if we can't get them in to get a provider to write a script. And so, and you can't even get to your provider now. So try imagining trying to get in within 5 days. So people are having a hard time with it. And so we're trying to work on that piece as well, particularly for the uninsured or people who have, from an equity lens, they can't leave their job during the day and they can't get into a provider. They don't have PTO or time off. So it makes it very challenging. Okay, next slide, please. So these are the 3 indicators that we're using. These are part of the CDC's, our switch to the community levels. Right now we're in high. So our COVID cases per 100,000 over the last 7 days is at 379.2. We can see that our COVID hospitalizations per 100,000 in the last 7 days total is 16.4. I will tell you that means we have about 26 hospitalizations. So, which is a far, cry from what we saw during the Omicron surge back in January. This is a lot lower number, which is good. But still, it puts us in a high category. And then the percent of staffed inpatient beds occupied by COVID patients is less than 10%. So it's in the medium category. There are currently 14 counties in the state of Colorado that are in high, community level of high, and 27 in medium, and the rest are in low. Most of the lows are in rural areas in eastern Colorado. Next slide, please. Put this graph together, which I thought was really good. It's the CDC's community levels for Boulder County over time. So you can see back in April when I was mentioning that community immunity was super high back then, we were in the low with a low number of cases, low number of admissions in hospitals and the beds that are occupied. And then over time, we moved from low to medium to high, which we're currently at, and the last date being June 9th. And I think what this data also suggests is that, our vaccines are holding up against severe disease. So when you take a closer look at this data, it's telling this story that is very similar to what CDPHE just released, which is that, compared to people who are unvaccinated, people who are boosted, so that means they're vaccinated and have been boosted, are less likely to be infected. They're 3 times less likely to be hospitalized and almost 5 times less likely to die. And that data really kind of shows up here that we're seeing pretty widespread community transmission. We don't fully know what community transmission looks like just because there are so many people doing at-home tests. And so they're not reporting necessarily into the system. But we know that there's fairly wide community transmission, but we're not seeing the hospitalizations and the deaths. And that's just, I think, a testament to the vaccines holding up against that severe disease. Next slide. This is just looking at case trends among age groups. The 7-day cumulative case rate per 100,000 really remains highest among those in the 35 to 54 age group. And, you know, those are kind of those top green and purple. But the case numbers themselves were highest among those 23 to 34. But we expect some fluctuation over time with these age groups. And I should share that, you know, we don't expect us to come out of being in high CDC high level transmission just because our wastewater data is starting to indicate that we're starting to see a little bit of a surge. So it's just going up. Next slide, please. Just quickly running through these just community testing and, you know, the EPI and what's happening programmatically. With testing, we learned today that Stasio and St. Vrain in Valley School District's Innovation Center will actually have been approved to stay open until the end of September, which is really good. So up until now, we've been kind of getting this month-to-month basis approval from the state. So it's nice that they've given us a few months to know that these will stay open. The others will be closing that we have on our website, I believe at the end of June is what they said. Again, we know that lots of people are accessing at-home rapid tests, which is great. Not everyone has access to those at-home rapid tests, and so we do try to promote that, particularly for older individuals, making sure that they're aware that they can access them through the federal government and also the state. But again, we're not counting all the cases because not everyone is going to the website to report it. In terms of our epidemiology, this is probably where we've seen the biggest shifts over the last few months. We'll be moving away from case investigation and contact tracing, which was kind of a main pillar for us during the pandemic. And we've done a lot of staffing in that area. And we'll be moving away from that towards really prevention and response and priority settings. So really focusing on infection prevention, helping with outbreaks in areas such as jails, shelters, and residential settings. And then our communication is really going to be general communication out for the public, but we're also going to start doing more focused communication for older adults, those who are immunocompromised, have chronic conditions, residing in priority settings, really encouraging people to assess their health, assess their risks, encouraging them to wear a mask and when they need to, maybe stay away from large gatherings, things like that. So really trying to focus on those high risk groups. And then in our data surveillance, you are aware that we shifted to the community levels, but then we are still monitoring and using the wastewater to inform our surgery. Next slide, please. And then we view this access to vaccines and therapeutics as really kind of our way out of being in a pandemic state. We feel that they're pivotal to supporting the community through future COVID surges, preventing deaths, and limiting the impact on our healthcare systems, which has been our overarching goal, is to limit the impact of COVID on the healthcare systems. And so we are, you know, we have vaccinations that we know that they serve as the #1 protection against death, hospitalization, and reducing infections. But the uptake is pretty high, right? So 78% of our residents are vaccinated, 64 are up to date. That's really good. We're very fortunate. But we don't know necessarily what the fall will look like, right? And vaccines will become important in terms of making sure those who are in those high-risk categories are getting boosted. We don't necessarily have a plan. We do have a vaccine mandate for our staff. We have decided that we're not going to require staff to be up to date, which means that they'll just be fully vaccinated and need 2 shots. And we had a conversation with Dr. Boulder about that. And feel good about the direction we're moving there. The focus groups that we're doing, just making you aware that we are working with parents of children under 12. We also have some teen and young adult communication campaigns that we're really excited about. And those will continue and help inform public communication. So really what we're trying to do is get everything in line for kind of back to school in the fall. And in terms of therapeutics, we did launch the website, still promoting monoclonal antibody therapies, oral antiviral medications. And as I said, we're going to be working really hard in this space because we're really concerned about the kind of barriers to accessibility to these things. So I think that's it for me. Any questions?
Indira, are they keeping stats on therapeutics?
You know, in terms of who's receiving them, is that that kind of data?
Well, yeah, like, I mean, obviously you tested positive, you've got symptoms, you go to your physician, they confirm, they prescribe therapeutics. And I mean, I guess, you know, you either get better, most likely you get better, but I'm just curious if they're keeping those kind of post hoc stats after administration.
I'm not sure, but you know, Dr. Belknap works at Denver. They might be keeping stuff. I don't know what your thoughts are, Bob.
Okay.
Yeah, thanks. If I can comment on that at least. I asked that question of the State Health Department a couple of weeks ago, and the answer was no. They don't have any statistics on who's receiving it. They have some limited data on who's dispensing it. So you know who's giving out the therapeutics, but nothing about who they're giving it to. So it's not a good way of tracking it. At Denver Health, we can see for the folks who are patients in our system and are receiving it. We have that ability. We are a test to treat site, so there are people who can be referred from outside, and you know they'll get in our system to receive the testing and the therapeutics, but then they may never we may never see them again. So we don't have complete data.
And I should mention that we don't have any test to treat sites in Boulder
Or
Yeah, thanks. Just following up on my earlier question about coverage. So Medicaid and Medicare covering therapeutics. And what about our FQs? I mean, are they able to administer therapeutics? That's what you mean by we do not have any test to treat sites?
Yeah, so a test to treat site means that you actually go to a location, you can get tested, or you might talk to someone through a telehealth, and then you can get referred right for treatment. Our FQHC said that they do not have the capacity to be able to provide that service. So we have been trying to encourage them to participate, but I think, you know, a lot of healthcare systems, including the FQHCs have been pretty battered. So it's been really hard for them to take them on.
So if an FQ is your medical home, where are you going right now if you need to access therapeutics?
You can still access therapeutics through your FQ. You just can't do an actual like one and done test to treat. You would still have to call and make an appointment to get in to see your physician. The state is working on some telehealth options that are low cost. But ideally, you know, because, and Bob can speak to this way better than I can, but because of some of the impacts on your liver, or making sure that you're eligible for it. So you probably do want your primary care provider, you know, doing that review for you. But I don't know, Bob, any thoughts about having telehealth just ask you and screen you for questions? Or
Yeah, I mean, I think telehealth is a reasonable option. The best medication therapeutic that we have, the Paxlovid, is safe. The biggest challenge is drug interactions, and so understanding, knowing what people are other medications, and also if people are taking any over-the-counter supplements or herbals as well. So really having a detailed understanding of what people are on is probably the most important step to know before prescribing it. But it really is around the challenge that with the test to treat program that the federal government stood up, which is, I think, a fantastic concept. But it was with the idea that, well, the tests have been provided for free and the therapeutics are being provided for free, but there was no mechanism for paying the provider costs and the infrastructure needed to actually do it. And so that's been the biggest barrier for uptake, to convince a site to do it for, so that it's broadly available, not just to the population of people who are already in care through their site. So that's why there are very few overall that are doing it. We only have one clinic that's listed that's doing it out of our network of FQHCs at Denver Health, and it happens to be the one that also has an urgent care and is doing infusions of the monoclonal antibodies. And so that's why they were already doing that and able to expand to do the test to treat for the oral therapeutics as well. But we for similar reasons, we don't have the capacity or the necessary funding to stop doing something else and divert resources to this. We can't afford to do that.
Okay, well, thank you for the updates, and guess we'll stay tuned as we approach the fiscal cliff.
Thank you.
Okay, have a good one, Indira.
Thank you.
All right, we are on to item 6, the budget study session update.
Thanks, Greg. I am just going to give a brief update. It looks like we have results from the doodle poll that we did with the board, as well as with 2 members of our Office of Financial Management staff at the county. And the date where everything synced and worked well together was Tuesday, July 19th at 5:30 p.m. Jordan will be sending out more information in the coming weeks, and hold your calendars. It will be virtual, and it will be open to the public, but it's likely no public comment will be taken at this time because it's a work session. So that's just a very small update. There's an explanation, obviously, in your packet about the nature of the session and what we intend to accomplish. But I just wanted to give you that brief update on behalf of Catherine Palmer, our Director of Administration and Finance. Thank you.
Okay, thank you, Camille. And yeah, we will look forward to getting that scheduled and on the calendar. Item 7 is legislative session update.
Yeah, thanks, Greg. Next, we have our Consumer Protection Program Coordinator, Lane Drager, who is very steeped in our policy and legislative work at the at BCPH. And so, Lane, I'll turn it over to you now. Thank you so much.
Thank you, Camille, and good evening, board. Want to just talk through some resources that shared with you to give you hopefully a good idea of different things that happened at the legislature this last session. So we had a lot of information in the director's report under the legislative updates section. So I'll kind of talk through some of that. Then also wanted to point out some of the resources that were shared in your overall packet. So one is the summary of the legislative session that our lobbyist for the Colorado Association of Local Public Health Officials puts together. And it's an incredibly thorough summary. So I think it's 22 plus pages or so. So that will really walk through all the bills that were being tracked, what the status was, some information about the bills, as well as just overall information about the session, and included a little bit of that in your director's report as well. But for our item tonight, just wanted to highlight at least some of the specific bills that we were very active on for CalFO, and then highlight a few bills that BCPH staff were also very active on, either providing legislative testimony or going to add to fact sheets or just lending our resources to those efforts. So we'll highlight some of those. So the two bills that CalFO was most active on, the first one related to flavored nicotine. And so it was an effort to ban those products. So think of our vaping products, as well as any cigarettes, cigars, any tobacco products. This was, as you might expect, an incredibly contentious bill. A lot of fighting on this one, a lot of efforts, changes were made, but ultimately this bill didn't make it through the session. So there was a significant threat of veto. If you recall, Denver was successful in passing a local ordinance to then have it vetoed by the mayor of Denver, believing that this should really be dealt with at the state level. And unfortunately, the governor's threat was to veto because it felt it should be a local issue. So a lot of work to still try to navigate these waters and figure out how to be successful. Potentially, we can start at a local level and see if we can be successful, but ultimately we do need to see this statewide for one municipality to have it and be able to sell it, and the one next door doesn't really help address the risks here. So that was an unfortunate bill that a lot of activity and effort went into, including staff from BCPH, but ultimately unsuccessful in this session. The other bill that had significant effort, also from our folks, I think, in the commissioner's office, was a air toxics bill. And so also another challenging bill, had a lot of efforts and ultimately a lot of changes. This one did pass. Instead of really getting into a lot of the regulation around air toxics, especially again at that local level where folks are often exposed at again levels that are dangerous in those small localities versus the larger airscape of tons of hazardous air pollutants. So the effort finally will be just to monitor and expand the state's monitoring efforts on those air toxics, with the hope then that there will be additional steps or potentially additional legislation based on what the findings of those results are. So those were the two most active bills that CalFO was involved in. The other bills, well, actually, in your director's report, and I think in some of the other documents I've shared, you'll get the full list of all the priority bills as well as all the bills that CalFO is monitoring, which is incredibly extensive. And that'll give summaries and hyperlinks to all those, so you can again see all of that in addition to that summary document. But wanted to just highlight some of the other bills that BCPH staff were active in. I've talked about the flavored tobacco bill, so our staff were part of that coalition and effort trying to move that forward, and I would expect we'll continue to be part of that as efforts continue into the future. The next bill is House Bill 1279, which was Reproductive Health Equity Act. So this bill did pass and was signed into law, and it is really focused on fundamental right to use or refuse contraception, and pregnant individual has a fundamental right to continue the pregnancy and give birth or to have an abortion. So really on those, again, some of those challenging things that we're seeing nationally, unfortunately, but that bill did pass. House Bill 1153, Marlowe's Law, affirm parentage, adoption, and assisted reproduction. So really looking at giving rights for folks that are part of that adoption process to be able to adopt right at birth, and it kind of walk through some of the details around that. So again, for people who may not be the biological parent. House Bill 1055, a sales tax exemption on essential products. So this really looked at period products, which is the nomenclature that's being used instead of feminine hygiene products, as well as adult incontinence products. So really removing the sales tax on things that are really essential for people at different points in their life. And that did also pass and was signed. House Bill 1157, collection of data for public health purposes, a fairness in data collection. So this one also was passed and signed into law. And this was really looking at getting that essential data we need in making decisions related to all parts of our possible folks that might be experiencing disparities. So specifically looking at race, ethnicity, disability, sexual orientation, gender identity. So really a focus for the state to make sure their efforts at collecting that data across the various programs they have is robust, so that we really can tease out that kind of information. House Bill 1289, health benefits for Colorado children and pregnant persons. This also passed and was signed into law. Again, looking at our health insurance coverage for low-income pregnant people and children in low-income families. So an expansion of that effort. Senate Bill 149 was an effort to improve the marijuana industry regulation. This bill was not successful. It was postponed indefinitely in the Senate, and you can kind of read some of the specifics in the report and the other summaries of kind of what the details were on that. And that's kind of the summary of kind of what was going on at the legislature this year. Again, please take time to read through that document from our lobbyist. They did a great job of really putting a lot of information together. And I'm happy to answer any questions you might have, or any other thoughts that you wanted to share.
I'll just jump in, Lane, to say thanks. The thoroughness of the document was really great, and I didn't get a chance to read through all of the different bills, but it was really helpful to know, where the county stood on various efforts and what happened with those bills, and just really thorough. So thank you for sharing that, and thanks also for all the good work that went into the legislative session with some good wins and more to do. So thanks.
Thank you. Yeah, I guess another piece, I know we started sharing information after our last update, and just wanted to also check in on that to see if that's kind of information that's helpful during the session, just to get a sense from the board what kind of communication thinking into next year would be most helpful for the board.
You beat me to it, Lane. I was just going to say thank you. I really appreciated what you all shared throughout the last couple months.
Awesome. That's great to hear.
And I agree, Lane. Thank you. Same reaction. It's helpful.
And the only thing I would add, because I thought it was also helpful, and I appreciated that you all, increased the communication with us throughout the session, also based on our feedback. And just if there are other opportunities, I think we were asked at one point to testify for one bill, and just thinking about how the board's voice can be leveraged either to testify, or again in writing letters of support, or in other ways in future sessions. Please do think about how the board can be supportive of the work that you all are doing, the state.
Yeah, absolutely. And if there's specific issues that any of you are really championing, please share that so that I can kind of have that in my mind, as well as the rest of our staff. So we'll kind of have that insight to know these are specific ones that you really are very interested in participating on.
Okay. Thank you, Lane.
Thank you.
Work with Calpo, and keep up the good work. Okay. We are moving on to item 8, which is the director's report.
Thanks, Greg. Yeah, thanks, Greg. It's a thorough report. As always, staff contributions make up the bulk and show off their expertise. I'm happy to answer any questions or lean on any of the staff present in the meeting tonight if you have a question you want to ask of us. So I'll leave it at that. Thank you.
Or anything, board? That's how thorough it is. Okay.
Thank you to the staff who every month contribute, and to Jordan Thomas, who corrals us all to put it together, and she makes it look nice. So thank you, Jordan, too.
It does look really nice. Thank you very
does.
much.
Yes.
Okay, that brings us to the end. Oh, sorry, I changed my agenda page. Okay, item 9, old and new business. Anything for any of the board members or the department?
Hey, Greg, this is Lindy, just a housekeeping item, and I apologize because I know we've covered this multiple times, but when are we planning on bringing ourselves back to sort of a hybrid approach to the board meeting? Do we know the timeline?
I would have to defer to Camille on that one in terms of the logistics that I mentioned earlier.
Yeah, yeah.
Yeah, Lindy, I didn't get an update ahead of the meeting tonight relative to where we are with making our rooms here at the Broadway campus, hybrid, so that we can continue to offer space for people who would like to join our meeting virtually, and then have some of us be in person. So we're very dedicated to that. I do know anecdotally that some of our colleagues in the community, even other city councils, went back in person and then experienced some issues with community spread of COVID-19. And so I think I'm not naming any of our colleagues wouldn't ever do that, but I'm being very cautious to provide space. So if people feel symptomatic or just our public who might be immunocompromised. And again, it's just been a challenge because there's such a demand for that throughout the organization, Boulder County in general, not even for the departments that have boards and commissions, but just who want to conduct hybrid meetings. And so I will be happy to email the board with an update after I connect with facilities and other staff who are involved in that direct communication. I'll get that out to you hopefully tomorrow. Thank you.
Okay, thanks so much. I appreciate it.
No problem.
Yeah.
Okay, well, that means we are adjourned. It is 7:09 p.m. Thank you to Camille. Thank you to the staff. Thanks to everybody who commented as part of the public comments. So we will see you next month. Have a good one.
Thank you.
Thank you.